Olympic Community of Health is a nonprofit in the Olympic region, which includes Clallam, Jefferson, and Kitsap counties and 7 tribal nations. We prioritize collaboration across the region, tackling health issues no single sector or tribe can tackle alone. This video series brings bite-sized conversations addressing local health challenges directly to your screen. We invite you to grab a cup of coffee or tea and join us as we dive into today's topic. Stigma involves negative attitudes or discrimination against someone based on distinguishing characteristics. Stigmatization is a co-occurrence of labeling, stereotyping, separation, status loss, and discrimination in a context where power is exercised. In nearly all societies, people have been stigmatized based on various identifiers, including but not limited to race, religion, culture, and health status. People with physical and mental health conditions, diseases, or disabilities often experience stigma. While some progress has been made to reduce stigma around some health conditions, substance use disorders remain one of the most stigmatized health conditions worldwide. Even though addiction is a complex brain disorder, societies often view it as a personal failing. There is an array of factors that contribute to and perpetuate stigma of substance use disorder. These factors range from lack of knowledge of stigma or contact with people with an addiction to media portrayals of racism and criminalization of addiction. While some of these factors may also apply to other types of stigma and other types of addictions, OCH focused on the factors contributing to and perpetuating the stigmatization of substance use disorder. Understanding the different factors involved can help identify areas to intervene to reduce and address addiction stigma, ultimately reducing social and health disparities. 2 partners who are doing great work to tackle stigma of substance use disorder are Burwell and Anya Callahan.
Hi, my name is Anya Callahan. I live in Jefferson County. I'm a social worker and a community advocate. I got involved in working with people who use drugs and working around harm reduction through my own personal experience of growing up in a household with an intergenerational history of substance use disorders. And today I am drinking peppermint tea.
I'm Burwell. I am a substance use disorder counselor and a mental health therapist, and I work for the Squamish tribe at their wellness center. I am also a person in recovery, so I'm drinking black coffee, and I actually made a special request that they brewed it last night and then kind of warmed it up again today because I learned how to drink coffee in AA meetings. It's interesting that this has kind of come late in my career. I don't remember this being a thing that I paid a lot of attention to early on, but the more work that I've done, the more important it's been to try to reach the folks that are kind of the hardest to reach, and that's where I encounter stigma a lot.
Absolutely. I think it's so important that even when people are using or in a period of relapse to say, I still love you and I still care about you, and thinking of loved ones who have had long-term recovery and then had relapse periods and then having a lot of shame about going back and saying hey, yeah, I'm actually using right now and I'm not doing well. And I know I was a leader in AA and I know that I've done a lot of community work, but I'm having a hard time. And I think that's why we see a lot of people who die from overdose during periods of short relapse because they're afraid to go into their community and say hey, I'm actually struggling right now and I need help.
That's the stakes, right? Is that we have this genuine epidemic of we're losing people. Anything that we can do to kind of get rid of that sense of marginalization, I think it's really important work for us to do right now.
Stigma around substance use and chemical dependency has impacted my life on many levels, probably most immediately growing up in a household with substance use and having a lot of personal shame around that and feeling if I shared with friends or my community what my family was going through, that there would be judgment and thinking that I come from a bad family or that I'm not capable of showing up in community in respectful ways. And then now in my professional life as a social worker and a community advocate, seeing it a lot, working in the housing spaces when, necessity to have abstinence-only, abstinence-based housing for folks, and realizing that, all of these social determinants of health, like substance use, is a coping mechanism. It's a maladaptive coping mechanism for dealing with trauma and dealing with the stressors of the world, and realizing that we need more understanding about like what this is. It's not a personal moral failure, but it's a social issue that just deserves community respect and treatment like all other medical issues do. Yeah.
As a counselor, one of the things that I'm trying to, as people kind of come to me to change their lives, right? I'm working in addictions. A lot of people they're trying to get themselves towards kind of a life around recovery. It's like I need to help them remove the barriers, and some of those things are like they're all the determinants of health stuff, right? I mean, the things that we talk about a lot, but stigma is actually a really big one, and it's also it's not real in the same way that like housing is real or like or not having a job is real. Like stigma is this thing that we've totally made up. I know I've watched like some of the language evolve, and there's been really a lot of attention to making sure that we use things like person first language. I don't know. What do you think about that? Like how has it been important for you to be mindful of the words that you use?
Language is really important when addressing stigma and when trying to change the culture around humanizing people who use drugs. So I'm even thinking of the word abuse. That's used a lot, drug abuse. I was looking at like a coroner report of Jefferson County, and it's like, this person had a history of opioid abuse. And I'm like, oh, what is abuse? And when I think of abuse, I think of child abuse, or I think of like violence, and drug use isn't abuse. It's dependency. It's a disorder, and so we don't say substance abuse, we say substance use disorder. Yeah. And even just little things like that, I think, can help to humanize people a lot. Addict, I know loved ones who identify as an addict. They're like, I am an addict, that's who I am, and like, if that's fine, if you want to call yourself an addict, I'm not going to tell someone who identifies as that how to identify themselves. But as someone who doesn't have a history of chaotic drug use, like I don't call people addicts. I call people who use drugs, or people in recovery, or people with substance use disorders. And so I think even that language is still evolving, because addict is still something that a lot of people use, and it's common.
I mean, we joke sometimes about like the alphabet soup, like our acronyms change every couple of years. And right now it's substance use disorder. And I think that we've landed in a really good spot with it. I mean, because it's self-explanatory. We're talking about, disordered substance use, right? So somebody whose use is having a negative impact in their life. I mean, more than likely a pretty significant negative impact. And that's what kind of meets our criteria for that. And it gets us away from a lot of the subjective stuff. And what another thing that I like about it is I do think that substance use disorder is probably more than one thing. But really what we're trying to figure out is what's the thing that's sitting underneath it, right? Is it like just a situational thing, right? Is it somebody who is unhoused who is using because, I guess, kind of why not, or because that's the norm within their community? And if they weren't in that circumstance, maybe they wouldn't use as much. Like that happens a lot. Is it somebody who's had a significant experience of trauma and just doesn't feel okay in their own skin, and drugs help mediate that? Like that happens a lot. And like I do think those are not the same thing. And so having the ability to actually get to that thing rather than having to focus on, I don't know, the top level stuff really helps us a lot.
Absolutely. We talk a lot about like person forward or person forced language, in social work and in healing spaces. And I think that, seeing someone as a person, and that like their identity isn't that they're a person who has this disorder, they're a human being. So like, let's use language to talk about that first. And I think it can have really big impacts on, getting more care and services for people. Because I also feel like there's a lot of fear around people who use drugs, and people who maybe aren't in relationship or aren't in the treatment world are just like, that sounds dangerous and scary, I want to stay away from that. But when we can start to humanize people and be like, hey, these are people with like a real substance use disorder that have, maladaptive coping mechanisms to trauma, and they deserve care like everybody else you treat at the hospital, and, changing the language around that to really bring up person first.
What gives you hope?
A lot of things give me hope. People like you who are in this work and dedicated to it certainly give me hope. I have a lot of hope in the research and the medical care that's coming out for people with substance use disorders. Also, something you said earlier that, there's less shame or more acceptance for people who are in recovery, being public about that. So just seeing more people who have long-term recovery or who are working towards being in a healthy space, stepping up and being a voice for their own community is something that's been giving me a lot of hope too. How about you? What's bringing you hope? What keeps you going over the last decade plus of work you've been doing here?
I don't know that there's like a watershed moment around the corner on this, right? What gives me hope is the progress that has occurred, right? It's not like we're gonna stop moving forward. It also gives me hope that I know that there's people who are kind of willing to put in hard work on this. And it's kind of my person. I value things that come by hard work. I don't like things that are easy. I don't trust them. And so kind of just the idea that I know that there's going to be this slow, difficult, incremental progress on this, that makes me believe that what we achieve is going to stick, right? And it's not going to. This isn't something that's just part of a trend, or maybe it's kind of the thing that we're paying attention to right now. But we'll be moving on to something else in a couple months. I think that we have been working on this for a long time. I know that the work has to continue. It goes back to where we started, because if we don't address this, we don't get to address the problem. And that work is going to be difficult, and it's going to be hard-earned, and it's going to be worth it.
Partners across the Olympic region are implementing projects to address stigma in their communities. For example, the Rediscovery program in Port Angeles involves a team of social workers, law enforcement, navigators, and case managers working to respond to mental health crises in the field, as well as proactively conducting outreach in the community. The Port Gamble Sklallam Tribe has a long-standing needle exchange program, and they also have naloxone kits readily available for community members. Everyone has a role to play when it comes to addressing stigma. Here are a few easy ways that you can help. As with other diseases, it's important to use person-first language, and there are many opportunities to reduce or remove stigmatizing language from websites, brochures, and more. We all have bias, and it's important to be aware of your own bias and lead with kindness while assuming positive intent. Take an online quiz to learn more about your own biases. Addiction science and brain science is constantly evolving. We encourage you to take a training, participate in a webinar, talk with a colleague, and learn more about addiction and trauma-informed approaches. Sign up for OCH's newsletter by going to olympic.ch.org to have resources and upcoming learning opportunities sent directly to your inbox.